For WHO, there is no evidence or information to suggest that the COVID-19 virus transmitted through houseflies. The virus that causes COVID-19 spreads primarily through droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. To protect yourself, keep at least 1 meter distance from others and disinfect frequently touched surfaces. Clean your hands thoroughly and often and avoid touching your eyes, mouth, and nose. For the researchers collected respiratory and fecal samples from 74 patients infected with COVID-19. Fecal samples from 45% of these patients were negative for the virus, but their respiratory swabs tested positive for 15.4 days from the onset of the first symptoms. Of the 55% of patients whose fecal samples tested positive, the respiratory swabs also tested positive for 16.7 days from the onset of the first symptoms. Their fecal samples continued to test positive for 27.9 days after the first symptoms showed. Thus, patients infected with COVID-19 had the coronavirus in their stools for an average of 11 days more than in their respiratory swabs. However, this study concludes that the researchers couldn't find out whether the virus in the stool was still viable, and they knew 0 cases in which the virus had been transmitted through fecal matter. The researchers outline the need for further research to know about transmission potential. Of course, the report doesn't mention the transmission of COVID-19 by flies anywhere, and it also says, no cases of transmission via the fecal-oral route have yet been reported for SARS-CoV-2, which might suggest that infection via this route is unlikely in quarantine facilities, in hospital, or while under self-isolation.